Good morning, good afternoon, good evening. I'm back with a new video about Osce, and today we are going to talk about assessment station. Assessment station including PHQ9. So without any further delay, let's start the video. So for those who are already preparing for the Osce, they would know that for all the Osce stations for assessment, planning, implementation, evaluation, and for all the skills, they need to follow a marking grid. So I would like to start the video with the marking grid for the assessment station. And if you get a patient with PHQ9, how are you going to tackle it within the time provided? So if we read the marking grid, there is a pre-procedure. What do you do in the pre-procedure, guys? Just think about it. So you can say, I entered the room, I check for the scene safety, I'll check for the patient privacy. What we do to maintain the privacy? We draw the curtains. So you can say, I entered the room, I check for the scene safety, I maintain the privacy by drawing the curtains, and then you perform your hand hygiene. This is the proper pre-procedure that you need to follow in all the stations, whether it's injections, or whether it's skills or API in assessments. Yeah, in the planning, that's the silent station, so you don't need to do it. In evaluation, evaluation it's also a silent station, so you don't need to do it. But in the implementation, assessment, in all the skills, you need to follow. You need to do the pre-procedure. Unless the assessor says to you, you don't need to do the pre-procedure, just start with the procedure. Then you start with the actual procedure. No need to do pre-procedure, no need to do introduction. So we are just following the marking grid today. We have started with the procedure. We entered the room, we check for the scene safety, we check for the privacy, and now we have done our hand hygiene with all the procedures stated, with all the process, by stating all the process of the hand hygiene. Yeah, and guys, you should practice maintaining the hand hygiene throughout the procedure. Whenever you feel like you have touched something, or before touching any patient, make sure you remember those moments when you need to hand hygiene, when you need to perform hand hygiene. Okay, so after the pre-procedure, we are going to do introduction. We need to introduce yourself and then explain to the patient why you are there, what's the purpose of nursing encounter at that point, and gain consent. After the pre-procedure, we are going to do introduction. Introduction is the phase where you introduce yourself and your purpose of the encounter. So you would say to the patient, my name is Saima, I'm here to take a set of observations on you, if you don't mind. So this is the point where you get the consent from the patient also, that you are going to take their observations, and what includes in the observation. Before you do that, you need to check the patient ID. You need to check the patient name, full name, date of birth, hospital number against their ID band, and the notes you have. So after checking the ID, you are gonna check the surrounding. If you get any possible cues, if you see cigarettes, you can ask the patient later on that, do you smoke? Because at the end of the assessment, you're going to ask them ADLs also. You're going to ask them their activities of daily living. So make sure you look around for the possible cues. If there are glasses there on the table, you can check you can ask them if they use eyeglass for reading, if they are reading glasses, or the normal eyesight vision problem they have. And also, if you have a pre-operative patient, if they're going for any surgery, and you see a bottle of water there, so just check with them. You need to remove that bottle of water and tell them that, have you had any water? Ask them if they have had any water, or they should not drink, and you're going to take this bottle away. All right, guys, and then now we have checked the patient ID, all the details, and then we have checked the surroundings for any possible cues. We are ready to take the observation. You can also ask the patient at this point if they are in any kind of pain, or if they want you to do anything before you start taking the observations. This is the time for you and for the patient to get interacted with each other and ask any questions if you have, or if the patient has any questions. Also, in this section, before you do the observation, you can ask the patient, like, do you know why you are here in the hospital? And if they tell you the reason, it would be good for you. And then you can also tell them why you're taking the observations, guys. So this was our introduction. Now you have an idea in the assessment section how we do the assessment. We do the pre-procedure check, introduction, and then we start with the procedure. Now we are at the procedure phase. We are going to take assessment of the patient. We got the scenario where our patient has depression. They came to the hospital, and now you are here to take their observation and to get to know your patient. Now we have done pre-procedure, we have done introduction, we are on the observation stage. Now we are going to maintain hand hygiene throughout the procedure, ensure equipment needed is functional and clean, and you also state next test date, next test due date of the equipment that you're using, and cleanliness of the equipment, and BP cuff is appropriate that you're using. So you can say that I have checked my what do you call it, diameter, or you can say BP apparatus. I've checked my BP apparatus is functional, is clean, and next test due date is this, and it's the BP cuff is of appropriate size before you take the blood pressure. You can also check for the thermometer. You can say that it's valid, the next test due date is this, and then you start. And after that you can tell the procedure, procedure to the patient. You can ask for their consent again. You can tell that I'll check your blood pressure, I'll check your heart rate, oxygen saturation, temperature. And then when you check the temperature, guys, you're gonna tell them, do you have any hearing aid? You can ask them if they have any hearing aid. If they have hearing aid, you need to take off the hearing aid for 10 minutes. Then you can check the temperature. You cannot just take off the hearing aid and check the temperature right away. But if they don't have hearing aid, if they have hearing aid in one ear, and then you can check the temperature in the other ear, that doesn't matter. So as I said, if they have hearing aid, you need to remove it and wait for 10 minutes before you take the temperature. And then also, guys, when you check the blood pressure, you need to choose the arm. You can ask the patient, which arm can I use for your blood pressure taking? If they say right arm, then you can ask them, have you had any surgeries on this arm? Or if you have any fistula, any cannula on that arm. If they don't have any cannula or fistula, then you can go ahead and ask the patient. And then again, when you're going to expose the arm, tell the patient that do you mind if you roll up your sleeves, or do you mind me doing this? Just take patient's concern with each and everything that you do. So and here we are going to check the blood pressure. Make sure, guys, you know where to check the blood pressure, how to check it. There should be a difference of 1 finger in between the cuff and the skin, and then it should be 2 centimeters above the cubital fossa. So make sure you know that how to check the blood pressure. And then before checking the blood pressure, you're gonna tell the patient that it may squeeze your arm a little bit, so don't panic. And then also for the temperature, before you take the temperature, you can tell them that you will hear a beep sound when I take your temperature. Now we have checked blood pressure and temperature. The next thing we're gonna do is heart rate and the respiration. And for the respiration, you don't need to tell the patient because it may alter the results. And for the heart rate, you're gonna check for 1 complete minute. Pulse or respiration also, you're gonna check for 1 complete minute. If it's a mannequin, you don't need to do it, but verbalize that I will check heart rate and pulse for 1 complete minute. Heart rate and respiration for 1 complete minute. All right, guys. Now here, guys, we have done all the observations. Since our scenario was the depression, and the assessor would give you a form. It says patient health questionnaire form. So the first thing you're gonna see here is patient name, NHS number, date, and then also it says over the past 2 weeks, how often have you been bothered by any of these problems? And then it gives you 9 problems. And then scoring also, if it's a 0 scores, it means if it's a, I'm not sure if you can see it, if it's a 0 score, means not at all, 1, several days, more than half the days, number 2, nearly every day is number 3. So let's read. Number 1, it says little interest or pleasure in doing things. So the first thing we're gonna read is over the past 2 weeks, how often have you been bothered by any of the following problems? Then our first problem is little interest or pleasure in doing things. So if they say that you can ask the patient, over the past few weeks, have you been feeling like you don't have interest in things or pleasure in doing things? And then they would say, yeah, for the past few days I'm feeling like that. how often do you feel like that? Then they would respond. The next thing is feeling down, depressed, or hopeless. Again, you can ask them the same question. So since our patient came with the depression, so they would say like, I have little interest in doing things, I feel tired, or I have little energy, or maybe they can say I have poor appetite or overeating. And then if they are depressive and then they have feeling of suicide, then you have this point here, feeling bad about yourself, or that you are a failure, have let yourself or family down. You have trouble concentrating on things such as reading the newspaper, moving or speaking so slowly that other person could hear. And then thoughts that you would be better off dead, or of hurting yourself in some way. So here guys, these are all the questions for patient health questionnaire. You don't need to ask each and everything to the patient at this point, because you won't have time. After doing the observation, you would have maybe already spent 8 or 9 minutes. So let's say in this scenario, it says patient came in with depression and feeling and haven't been sleeping for the last 3 days, and they have also suicidal thoughts. There you can see, you can ask 2 questions to them. For the past few weeks, have you been trouble falling asleep? Have you been having trouble falling asleep? Or are you staying asleep or sleeping too much? So since they came with the insomnia, you can ask them the question related to the sleep. Then the next thing is, we said that they having suicidal thoughts. Then you said, are you feeling bad about yourself, or that you are a failure, or have let yourself or your family down? Is this the case? How often do you feel that? Are you feeling this for several days, or nearly every day you feel that? And the patient say that I feel that nearly every day, or I feel that more than half the days. Then whatever they say, you can circle it here. Let's see, if they say that I'm having trouble falling asleep for the nearly every day, and then it says past 3 days they're having, so it means they are having trouble falling asleep nearly every day. There we gonna circle number 3. Then we also said that they are feeling bad about themselves, and then you can also ask them like, is this the case every day that you're feeling bad about yourself? If they say yes, or it's nearly every day, or the more than half the days, then if they say more than half the days, then you can circle number 2 here. So if we count it, also suicidal thoughts we talk about, so we can also ask them, do you have thoughts that you would be better off dead, or hurting yourself in some way? If say yeah, sometimes, several days I feel that, then okay, we have circled trouble falling asleep nearly every day. We have circled number 2, feeling bad about yourself more than half the days, and then we have also circled number 1 for thoughts that you would be better off. So how many total we have? 3, 2, 5 and 6. So we can say total count is 6. So here you have columns total. Here it would come number 1, 2 here and 3 here. So that would be our total number 5. Let me just circle it for you. See here, as you can see. So we have circled number 3, nearly every day they are feeling feeling they cannot sleep. Here number 3. The second question we asked, are you feeling bad about yourself, or that you are a failure? They said more than half of the days. Then you circle number 2. The last question we asked, do you have thoughts that you would be better off dead or hurting yourself? They said yes, several days I feel that. Okay, then at the end of these 3, you can ask 3 questions, guys. You won't have time to ask all of these questions, but let's say if they say that they don't have any problem with sleeping, they have just little interest, or they're feeling down or depressed, or they're having poor appetite, then you can circle on those points. Yeah, these are the things the the patients with depression can present with. So you just have a clue that these are the questions we can ask. Now we have gathered all the information. We're going to total it, 1 here and then 2 here and 3 here. So we have 6 total, isn't it? So our PHQ9 score is 6 here. Now at the back of the paper, at the back of the PHQ9, you will get this all the information. You don't need to remember each and everything. Here it says PHQ9 score, provisional diagnosis and treatment recommendation. So if the score is 5 to 9, the provisional diagnosis is minimal symptoms. We got 6. So our patient is having minimal symptoms. What are the treatment recommendation for that? Sport, educate to call if worse, return in 1 month. So we're giving them sport, we're going to educate them, and if worse, return in 1 month. If the score is 10 to 14, they have minor depression, dysthymia, major depression or mild. Then also we will be providing sport, watchful waiting, antidepressants or psychotherapy. Then if we have 15 to 19, major depression, moderately severe, antidepressants or psychotherapy. More than 20, major depression, severe, antidepressant, psychotherapy. So you will be provided with all the information that you need to tell the patient. You don't need to remember everything that my patient is getting score 10. What would I do? I will memorize all this. You don't need to. Just they will give all the information. Just read at the back of the paper and tell the patient. Now we are still in the assessment section. So here you need to practice every day. You need to practice doing the observations and PHQ9, and then also at the end of the what do you call it, this PHQ9 questionnaire, you can ask the patient, how does this affect your activities of daily living? The things we ask, they are also in the activities of daily living, isn't it? They are depressive, they cannot sleep, they are feeling bad about themselves, and also they are thinking to kill themselves. If they say, I'm very depressed, I'm hopeless, I'm having poor appetite, I don't feel like I want to eat. Okay, so these are the activities of daily living, I would say. So now you don't need to ask them again, but if you have time, just ask them, how does it affect your activities of daily living with depression? And then they would say, yeah, the things we mentioned earlier. They can say that I'm overeating, I have poor appetite because of this. And then now guys, we have checked the observations, we have checked the PHQ9, we have checked the activities of daily living. Yeah, these are the 3 things that you need to make sure you do it in the assessment section of PHQ9 of a depressive patient. We have done all these things, and then if you practice it, you can do it in 10 minutes. You can do it in 11 to 12 minutes. And then now you have documented all this section, right? You need to write, make sure the patient name is there, NHS number, all the details are correct, and also that you still need 1 minute to document your observations that you have taken. And if it's a mannequin, the examiner will give you a tiny paper with all the observations, that you need to record on your news chart. Or if it's a PHQ9, I think they give you that, let me see if I have that, paper. Yes, if it's a PHQ9, they give you this observation chart, which says observation chart, NHS number, patient surname, first name, and then it's just blood pressure, pulse, temperature, respiration, and your initials. Also the date and time is here. So this is the paper they give with the PHQ9, not the news chart. If they're asking you to do news chart, then they will give you the news chart and normal observations. If they're asking you to do if you get patient with a head injury or hematoma or something like that, then they will give you a neurological observation chart, and then also the GCL, also neurological observation chart. And then you do the assessment, you do follow the neurological observation chart, and you ask the activities of daily living. Okay guys, so make sure you remember, if you get PHQ9, there are 3 things you need to do. Observation, observations, PHQ9 score, and activities of daily living. In the PHQ9s, there are activities of daily living, as I mentioned earlier. So you can just use your senses and just say that how does it I know you mentioned that you're having trouble sleeping, you are not eating, but is there anything else that bothering you with this depression, or is there anything else troubling you except this sleeping problem and eating habits? Just it's just a one sentence, but it will save you loads of time. And if you're doing if you're doing must also, in must also, you do all the observations, you do the must score, and you do the activities of daily living. Yeah, these are the important things that you need to remember, and make sure guys you practice, because if you don't practice, you can forget that. You may not ask the activities of daily living. If you don't ask, how are you gonna plan it later on? How are you gonna do it in the evaluation section? How are you gonna write it without asking the patient? Now here we did the observation, we have we had a PHQ9, and then we also ask, like before starting the observation, we ask the patient, right, do you have any pain? Is there anything you can do before starting the procedure? So it takes time. If you saw cigarettes on the table, you can tell them, do you smoke? You can ask them, do you smoke? And if they say yeah, how many cigarettes do you smoke? Let's say they say like 30 cigarettes a day. So on the same time, you can tell them that I know it's not the right time, but I cannot keep the cigarettes here. I cannot keep the cigarettes here openly. I need to lock them, or because we are not allowed to keep the cigarettes in the hospital, isn't it? So you can tell them that I need to lock it, or just to give it to your next of kin. And then you can tell them that, have you ever thought about quitting? They would say yes, I am, or no. Whatever they say, you respond accordingly. All right guys, I hope this video was helpful. If you like it, please share with your friends and colleagues, and then keep watching, keep liking the stuff if it interests you, if it's informative. And then don't hesitate to comment in the section below if you want me to make video on any particular topic. Don't hesitate to put it in the comment section. All right, thank you so much for watching. Take care, have a good day. I have a sample video of assessment including PHQ9 on my channel. If you want to see the example how to do it in the time limit, please watch that video. Thank you. Have a good day, guys.